let's talk about the potential negative side effects of a vasectomy. And there are some, but they rarely occur. We're talking about less than 1 to 2% of all vasectomies. So what are the potential negative side effects? Well, the main negative side effects would be something like the post-vasectomy pain syndrome, which occurs in less than 1% of all vasectomies. And what that is the man has a vasectomy and he has pain. And the pain doesn't go away for over 6 months and sometimes lasting longer. That is considered the post-vasectomy pain syndrome. And it's treated a number of different ways, anti-inflammatories, pain meds. In the worst case scenario, you reverse the vasectomy, and 99% of the time, you will have relief of the pain. Second negative side effect is something called a hematoma, which is a blood clot which forms immediately after the vasectomy. Probably occurs because there was some bleeding going on, the surgeon didn't see it, sent the patient home, and what it looks like is the patient will be home and he notices that his scrotum is quite large, sometimes the size of a softball. That's a blood clot that has formed in the scrotum. Now, generally speaking, those can be observed unless it's really big, then the blood clot has to be evacuated surgically. But even if that occurs, there's generally no long-term side effects from a hematoma. The other two side effects which are negative that can occur is called a vasectomy failure. When we do the vasectomy and the patient never winds up shooting blanks, that does occur. It's probably an early, what we call recanalization, where the tubes were not separated properly or something technically was not performed, in which case the vasectomy has to be redone. Again, we see that less than 2% of the time. The other side effect would be a late failure known as recanalization. What happens here is that the patient has a vasectomy, he is shooting blanks, then later on, a year or 2 or 3, somebody gets pregnant. What's happened there? The tubes have actually wound up recanalizing, going together again. We don't know why that happens. We know that it does happen. And in that case, the vasectomy has to be redone. But overall, the vasectomy is a super safe procedure. Long-term side effects are minimal. We're talking about less than 1 or 2% of the time and quite safe. Now, if you want to know more about vasectomy, hit the link in my bio and I will send you my free vasectomy decision guide. And by the way, if you like this video, hit follow.